I'm Michael Morrisey, a professor of health economics in the Department of Healthcare Organization and Policy in the UAB School of Public Health. What David Becker, my colleague here in the department, and I have done is to try to look at what the financial and economic implications for Alabama would be if the state chose to expand its Medicaid program. In the typical year, in the first 7 years in which the program would be in effect, from 2014 through 2020, that on average there'd be about 293,000 additional Alabamians who would be covered under the Medicaid program. The federal government picks up most of the costs of that program, 100% of the claims cost in the first 3 years, declining to 90% in 2019-2020. The implications of that is that the federal government, by our estimates, would spend something like $11.7 billion in the state. Alabama would have to put up $711 million over the same period as our share. We estimate we'll be covering 293,000 people in Alabama in each year. And after Alabama pays its share of the matching dollars over this time period, the net inflow of monies after we've paid our share of Medicaid is $935 million. So from that perspective, the state picks up a lot of additional income and covers a lot of the uninsured. There are reasons to consider sort of not doing it. It is an investment. What that means is the state has to come up with its share, $771 million by our best estimate. And those are monies that it's difficult for the state to come up with. The next step is for the state of Alabama to decide whether or not it's actually going to go forward with the expansion. Governor Bentley has said at this point he's not interested in expanding the existing Medicaid program, but would like to see the Medicaid program reformed and would sort of reconsider an expansion under those circumstances. One of the things that's important for us as academics is to walk a clear line between doing responsible research and advocating. From our perspective, what we've tried to do is to lay out the economic case, both the pluses and the minuses, as clear and unbiased as we can, and not to sort of act as an advocate for either expansion or not expansion. That's a broader question for the citizens and the legislature and the governor to decide. But what we wanted to do is to present the data and the implications as clearly as we could.